So thank you everyone for being here. Really appreciate you, Steve, taking the time out of your day to chat with us and Hargan as well. So welcome, folks. This is the first part to the cannabis and mental health series called Conversations on Polysubstance Use. We are here with Steve Keller, who has been an ally of the project and as well a really big collaborator for the Cannabis and Mental Health Project. And he's here talking about the work that has been doing with Drugs Free Kids Canada. As well, he also was working with the YMCA with the YCAP program. But I'll also let Steve introduce himself. I'll start first. So my name is Kia. I use she, they pronouns, and I'm a strategic advisor for the Cannabis and Mental Health Project. I've been a part of the project for a few years now. It's ever growing, always changing, and incredible. And I live on the land of the Samiamoon Nation in White Rock, British Columbia. And I'll pass it off to Hargan.
Thanks so much, Kia. Really excited to be here and be chatting with Steve. My name is Hargan. I am a medical student at McMaster University and been working with the project for 3 or 4 years now with the Youth Action Committee and now more on a strategy and advising role. Really excited to be part of this conversation and hear more about Steve's perspective.
Thank you so much for having me in. My name is Steve Keller. I am the program developer and national speaker for Drug Free Kids Canada. Formerly, I was the content developer and national speaker for the Wise Youth Cannabis Awareness Program, as well as the Youth Gambling Awareness Program on a provincial scale. My pronouns are he, him, eel, and I live in beautiful, chilly Peterborough, Ontario, upon territory of the Mississauga Anishinaabe, adjacent to the Haudenosaunee territory. And I love that there's a moment taken at the start of these discussions to really acknowledge that land. I love doing it when I present nationally. I do it when I present locally. It's a place I've grown up. I've been really fortunate to kind of grow up in this region, and especially in my role, really getting to work with the Indigenous communities, whether that's Tyendinaga, whether that's Hiawatha, Curve Lake, Alderville. Uh, and anytime I can give a shout out to those communities. They're very strong, they're very vibrant, and I've learned a lot over the last few years on substance use, working with their professionals and their community members at large.
Thanks so much, Steve. And yeah, I really appreciate you taking the time to also acknowledge those communities. I will also mention for audience members that two Youth Action Committee members, so Melisha and Connor, have also created a really beautiful territorial acknowledgement video that can be found on our YouTube channel and as well as our website. So we'll make sure to check that out. But Steve, would love to know, I know we've been talking here and there, but would love to know what you've been up to lately with DFK. And for those folks on the call at Drug Free Kids Canada, it's just easier to call it DFK. What you've been up to, and yeah, what's the work looking like that you're doing?
Absolutely. And the first thing I like to start off by noting is sometimes people hear our title, Drug Free Kids, and they think we're coming in with an abstinence-based approach, which is not the truth at all. The discussions that we have around substance use still focus on agency of choice, taking a neutral approach to substance use, and really trying to cultivate a balanced perspective on the subject. Contrary to the roles that I did when I worked in cannabis and gambling awareness, one of the things I enjoy about working for DFK is I actually get to do research and collect information on all substances. So I've been doing developing workshops on cannabis, alcohol, nicotine, so vaping and tobacco. More recently, I actually put together a workshop that explores the overdose crisis, looking at opioids, but also looking at sedatives and stimulants. Because in order to really understand what's going on in that field, understanding opioids alone, I don't think any longer is really enough. And again, going over to cannabis, in order to really have a more holistic understanding of potential risks and potential harms associated with cannabis, it's equally important to consider the other substances that have been normalized around it. And the big two that we would look at in that situation would be alcohol and, I'll say, nicotine products, so tobacco as well as vaping. They have to be separated in some ways, but are combined in others. But in addition to presenting and taking more of a regional approach and supporting communities, DFK has our website, drugfreekidscanada.org. You can find all sorts of resources there, including quick bits of information on various substances. We have our talk toolkits on cannabis, on opioids, on vaping, on alcohol. We're actually putting out a new cannabis talk kit, I believe, in November of this year, October, November. We developed one back in 21 through SUAP funding. It was actually reviewed by the CCSA prior to release. Actually, when I worked at the Y, it was a resource. Their resource, the CSSDP's Cannabis Talk Toolkit, which was brilliant, by the way. I'm a huge fan of what the CSSDP put together with the Get Sensible project. They were absolutely inspired. And when it came to having conversations and supporting youth, which is really what DFK is about, I couldn't think of stronger resources than, like I said, the one we have at DFK, the CSSDPs, and the CCSA actually has a great one too. I think it's Talking Cannabis for Youth Allies. Um, so I've dipped into a lot of the research over the years, and like I said with DFK, I've really just been able to expand that discussion to a multitude of other topics.
That's incredible. I mean, like, I'm always impressed with the work that you're doing. And I love that you know, how you've acknowledged that young people aren't using cannabis in a silo. Oftentimes, when people are using weed, it's cannabis either mixed with tobacco or alcohol. So I guess, like, we'd be curious to know what some of these, I guess, effects are like and some of the impacts of using cannabis with other substances, if you do have any high level information on that.
Absolutely. Well, the first thing I can say is if we're actually even looking at prevalence of co-use, the Canadian Tobacco and Nicotine Survey actually reported that approximately 12.2% of Canadians report polysubstance use and mixing substances together. So when I'm talking polysubstance, it's more than one substance at the same time. The most common substances that tend to be combined include inhaled cannabis and weekly or daily use of alcohol. This number comes in at about 29% of those who report polysubstance use. And we see a similar sort of a trend in that alcohol is the most commonly used substance in combination with cannabis in other surveys. In fact, the Canadian Cannabis Survey from 2023 reported that approximately 40%, so about 2 in 5 people that consume cannabis report using with alcohol, either sometimes, often, or always, compared to about 24% reporting mixing with tobacco. The numbers of other substances, just on a side note, in case you're curious, they do tend to be fairly low. Between 90 to 99% of people would say that they never mix cannabis with hallucinogens, with sedatives, with stimulants, with illegal drugs. So the two big ones that we see are alcohol and tobacco. And if we're looking at specific risks to polysubstance use, um, should we start with alcohol or do you want to start with tobacco? Which way do you want to go first?
I think I'd start with tobacco. I don't know why that's my
Mhm.
inclination, and then I'll move to alcohol.
I think it's a good idea because the conversation on alcohol, from what I've seen, anyways, in the research and what I understand, is a little bit more deep, shall we say. When we look at tobacco and cannabis, the first risks that we have to consider are tobacco consumption has been going down. It's been going down for a fairly long time, particularly among young people, although in recent years that number has flattened out. Some surveys have actually reported a slight bump up in youth tobacco consumption. But a factor that plays into that is that youth will mix cannabis with tobacco. So exposing a youth to tobacco use through the inclusion of cannabis does open that door to some of the physical risks that we know tobacco poses. We know that tobacco contains, over 80 different carcinogens, cancer causing chemicals, and including them and mixing them in with cannabis is simply increasing your risk profile of physical harm. But when it comes to actual impairment with cannabis, research does suggest that using tobacco in combination with weed products can actually increase the body's ability to sort of process and absorb THC, that impairing substance. So when we talk about THC, delta 9 tetrahydrocannabinol, it's that substance that when we talk about being high is really that's what a person is being impaired by. When you introduce and you mix THC with tobacco, like I said, studies have actually found that a person will become more impaired by using less cannabis if they include tobacco as well. Now, again, some people may hear that and go, well, hey, I can save some money. I don't have to use as much weed if I add in tobacco. But again, what they're exposing themselves to are those physical harms of tobacco. But the second thing they're exposing themselves to is a greater risk of addiction. Nicotine is one of the most addictive substances on the planet. Depending on what studies you look at, the rate of heavy or dependent use of nicotine among people who use it come in between about 80 to 90% of people who begin using nicotine will become addicted to it. So introducing that to cannabis can make it even harder for a person to try to quit using one or both substances, especially as they use over time. And when we look at cannabis, we do know that about 1 in 6 people that report using cannabis during their teenage years will report issues with addiction or dependency. at some point in their life with cannabis. So really the big two with tobacco are the introduction to the various lung diseases that we know tobacco can cause, the increased risk of over intoxication or getting more impaired off less cannabis, and the third one being the risk of addiction. I know I said two, but I counted three. My math's a little off this time of day.
And Steve, I just wanted to ask a quick follow-up. I know you talked about, how some of the risks can certainly be elevated when you're combining different substances together. Do you have any insights on what harm reduction looks like in polysubstance use and how it might be different than individuals who are just choosing to use one substance?
Well, the first thing that I know when it comes to mixing cannabis with substances is to consider the potency of the product that's being consumed. So we know that different cannabis products will have different strength or levels of THC. For example, dried leaf cannabis, when we're looking at strength or potency of THC, comes in around anywhere from about 15 to 30%, depending on the product that we're looking at. But then we have physical extract products or chemical extracts. These are things like hash, keef, live resin, honey crisp, vape products, e-liquids. Their THC potency can be 60%, 70%, 80%, even up in the 90s. So one of the things that I would recommend for someone who is mixing substances together, if they're using cannabis and another substance, is to look for cannabis products that have lower THC to begin with. If they're set on mixing substances together, then that would be the first thing I would recommend. Is if they're going to be consuming multiple products, is to look for one that has a lower potency overall. The second thing, I mean, the the easy answer is to say, well, it's recommended that a person avoids mixing substances. So generally, what I say in that regard is if someone does use tobacco and uses cannabis, my recommendation is they would choose one or the other. If they're having a night they're consuming cannabis, they either avoid using tobacco or use less than they normally would. Or on the other hand, look at using less tobacco than they normally would. Uh, or using less cannabis, sorry, than they normally would. Because the issues with cannabis impairment, and we know that there are some if a person consumes more THC than they can handle, can include things like fever, heart palpitation, nausea, vomiting, delusions, hallucinations, panic or anxiety attacks. So, of course, as the amount of THC that's being sort of processed in the body and absorbed is increasing, the risk of those sort of unwanted effects can happen. So while someone, again, they may think that mixing with tobacco may be a better way for them to feel as impaired with less or more impaired with the same amount, that may sound fun on the surface. That may sound interesting on the surface. And for some people, it may be. But for others, they may just be opening the door to some of those risks of cannabis poisoning or overconsumption of THC. So again, the first thing I would recommend is looking for lower THC potency products, or if they're not changing the product they're consuming, looking at setting a bit of a lower limit on both of the products that they're using if they choose to mix.
You go ahead, Harvey.
No, I was just gonna say I think that's really insightful to hear, and even just learning a bit more about how does cannabis affect you differently when you're using other substances allows, individuals to just make more informed choices, like similar to what you're saying, Steve, of how much do I use? Do I use when do I use type of a thing? And so I think those are really great practical tips to think about. Um, I know that you mentioned you touch on alcohol as well. And so I guess I'm just wondering, asking the same question, but for alcohol, what do the effects look like and how can you mitigate some of those harms?
Alcohol is a fascinating substance when you mix with other substances. I often say when I'm presenting on any type of substance in a presentation, alcohol does not play well with other drugs, regardless of any substance, whether that's over-the-counter medications, cannabis, opioids, sedatives, stimulants. Alcohol is a substance that mixing it with any other drug can be quite risky. So if we use cannabis as an example, the effects can actually change based on the order in which a person consumes them, which is fascinating to me. So, for instance, if a person uses cannabis first, they take an edible, they smoke a bong, they hit from a vape pen, they start to feel impaired. They have a couple beers, they have a glass of wine, they have a few shots, whatever it is they're drinking. Research actually shows that people that consume cannabis before drinking may actually not experience the feelings of intoxication or drunkenness from alcohol as quickly as they normally would. So what happens is THC actually affects the brain's ability to really interpret that it's becoming impaired by another drug. So if they're drinking alcohol, they may not feel that drunkenness or that intoxication that they're expecting to feel. Some people may interpret that as an opportunity to consume more alcohol to feel the same way that they're trying to feel. And this, of course, increases the risk of alcohol poisoning, hangovers, dehydration, nausea, vomiting, blacking out, some of those things that we see with alcohol overconsumption. If you consume alcohol before cannabis, it's a similar sort of effect to consuming tobacco with cannabis. Research has shown that alcohol can cause the body to become more impaired by THC than it normally would, which would mean that a person can get, more high off the same amount of weed that they would normally take, which again, for some people may be more entertaining, but for others may present some of those risks I spoke about earlier, the dizziness, the nausea, the heart palpitations, the fever. And many of those risks are very similar to the risks of alcohol poisoning. So you're mixing nausea on top of nausea, fever on top of dizziness, confusion on top of confusion. So mixing those two substances together can open the doors to some quite unwanted effects, shall we say. The other thing to consider is that alcohol is a diuretic. And for those of you that may not be familiar, a diuretic is it's a substance that we take that tends to push fluid out of the body. Caffeine's an example of this. Consuming caffeine tends to make a person feel more thirsty because it sort of pushes fluid out of the body. Alcohol has that effect. This is actually why it's recommended that people that are drinking, more than one drink or more than one or two drinks are recommended to take drinks that have water to keep themselves hydrated. Cannabis can also have diuretic effects. It can cause dry mouth, dry throat. It can sort of dry the body out. So when you're consuming it on top of alcohol, there's that increased risk of dehydration. And if you look at a hangover, so those people that suffer the adverse effects of alcohol the morning after, many of the symptoms that they're experiencing of a hangover are really just caused by dehydration. They're experiencing migraine, they're dizzy, they're stiff, they're weak, they're feeling frigid, their muscles are tense. A lot of this comes from the lack of fluid in the body. So one of the things that we recommend if you're consuming alcohol, period, let alone mixing alcohol with anything else, is to keep yourself hydrated. The second thing is to remember that impairment may not feel the same when you're high versus when you're not consuming cannabis. So if a person's smoking weed and then deciding to have alcohol, it's recommended that they drink less than they normally would. And if they're drinking prior to using cannabis, it's recommended that, again, they either avoid using cannabis altogether, or if they're going to, they use less or look for lower potent products.
Thank you.
Another issue that sorry. Go
Oh,
ahead.
no. Go. I just wanted to add something really, really quick because it's interesting that you said that, and I was never quite sure if it was just like an urban legend or something people said, but there's like this old rhyme that I grew up with, which is like weed before beer, you're in the clear. Beer before grass, you're on your ass. Have you heard that? It's like, yeah, it's just like a very common thing. And I remember hearing it in high school and like not really sure if it was true or not, but now talking to you, I'm like, okay, there is like evidence that oddly supports that. And obviously it's not as simple as weed before beer, you're in the clear. It's just that you might not experience in that moment the adverse effects of mixing cannabis with alcohol. Um, and I guess is the term bioavailability, is that what it's referred to? Like when alcohol increases the, maybe it's not.
So bioavailability refers
Mhm.
to how much of a product you consume does your body
I
actually
see it.
absorb.
Yes.
So if you're taking Advil, for instance, you get like
Mhm.
I wish I had a bottle of Advil in front of me as an example, but if you
Right.
take a pill, your body doesn't absorb the entire pill through its system. It only actually
Right.
absorbs and sort of metabolizes a certain amount of it. That's called bioavailability. So when we
I
look
see.
at dried leaf cannabis, research
Mhm.
has shown that dried leaf cannabis, the body really only processes, I believe it's around 20% of the THC that it absorbs.
Right. Okay.
But again, if you consume nicotine or you consume alcohol, that percentage can actually increase. It influences the
Mhm.
body's ability to actually process and use it. Edibles have a much lower bioavailability, but what's interesting about them is THC actually changes in the liver when you consume it, when you actually eat it. It processes into what's called 11 hydroxy THC.
Mhm. Mhm.
It's which is kind of funny. It's almost like your liver identifies THC and goes, "I don't actually want this substance.
Yeah.
It's going to do something I don't want." So it actually redistributes the THC molecule down into what's called 11 hydroxy THC, which is a smaller molecule that can
Mm.
pass through membranes and pass into the brain a little
Right.
bit easier. And research has also shown it can be anywhere from 1.5 to 7 times as potent as delta
Wow.
9 THC, which is
Wow.
why many edibles that don't have as much THC as, say, a joint will have can actually get a person as high or more high
Right.
than the joint will.
Right.
I always laugh. I used to talk about that in one of our workshops at the Y, and I used to joke, you come in for a drug presentation and the math class breaks out.
Right.
It's not really what the students
Sure.
were considering was going to happen, but it really is important to understand these sorts of things,
Mhm.
that quantity and that amount that you're consuming, it needs to be lowered a little bit when you're mixing substances together.
Yeah.
And this is what makes it so risky to do. And that's why we often recommend that if a person's drinking, they avoid using other substances altogether. Or if they're using other substances, they definitely avoid alcohol. And if they're going to consume, that they set their limit to be lower than it normally would be. So,
Thank you. That's great. And then just going back to cannabis and nicotine quickly, I guess in the data that you have, do you know like the mode of consumption for nicotine? Like, is it through cigarettes? Is it vaping? Because I know that there's like a lot of discourse with just the advent of vapes and how commonly they're used amongst young people. So do you know like, is there a difference between those modes of consumption or even like nicotine gum mixed with cannabis? That might be a skosh too specific, but curious.
it's a good question, and I would be curious to see a little bit more of the, because often what the research talks about is tobacco and cannabis use. You see a little bit more on the vaping side, but usually they're talking about dried leaf products and dried leaf tobacco. I would be curious to see a little bit more of what we see about vaping and absorbing nicotine through that manner. Because one thing I know about vaping cannabis, when we go back to that bioavailability conversation, the body actually absorbs more THC through a vape than it does through dried leaf product. And there's actually a reason for that. It has to do with the temperature at which the product is burned. And this would be similar, I would assume, with a tobacco cigarette and a vape pen. Because when you combust weed in like a joint, a pipe, or a bong, it's burning 400, 450 degrees Fahrenheit, and that THC is actually burning off. The same thing happens with a cigarette. The nicotine is actually burning off before the person can inhale it. With a vape pens don't burn quite as high. It's more of a lower heat, so there's actually more product available to be absorbed into the body. So I would be curious to sort of see those risks associated with nicotine and cannabis if it was specific to e-cigarettes and cannabis. But we do know with THC that the concentration of THC in a vape is certainly higher.
Thank you. Yeah, really, I was really curious about that. Um, yeah, I guess I'm just referring to our other question. So I guess we're kind of popcorning here, but I'm curious like how we should be talking about or ways that you talk to young people about polysubstance use and how to support young people that may be curious or might already be like using multiple substances at once. Like how do you go about navigating those conversations?
The first conversation that I actually find is quite helpful when you're discussing any form of substance use is to ask someone why is it that they're using the substance and what are they trying to feel? And this can really be the case when they're mixing substances together. If someone says they're consuming cannabis because they find it pleasurable, they're having fun using, and they also say, well, when I drink, I feel that way too. Then a question you can really ask them is if you're getting that feeling out of one of these substances, what is it that's maybe motivating you to have both? Because if you require having both, then are you really getting as much of that emotion as you think you are from using one? And that may just get them to really consider their use in and of itself. The second thing that I do often highlight is considering the risks of mixing substances together. Because there are some that are, like I said, that are a little bit more frequent than others. Those over intoxication, increased impairment, delay of onset drunkenness, for instance. But there are also some that I bring up, not as fear tactics or not as scare tactics, but just to highlight that there can be significant scenarios. And one of them, it's kind of funny, actually has to do with one of the medical uses of cannabis. So, out of curiosity, are you guys familiar with the approved medical uses of cannabis here in Canada? I believe there's three of them that we know that are approved.
No.
So the first is support for inflammation and chronic pain. The second is to stimulate appetite. This is particularly the case with people living with like cancer, HIV, AIDS, going through radiation chemotherapy. But the third one is that CBD and low dose THC can actually act as an antiemetic. It can prevent feelings of nausea and vomiting. It can sort of help relax the digestive system to prevent a person from throwing up. Medically, that can be certainly quite helpful, right? What I've actually seen from reports in addiction centers and treatment centers in the US, I haven't seen this in Canada, but I've seen it in a couple places in the States, is they've actually had clients or people coming in or patients coming in who are experiencing alcohol poisoning, but they also smoked weed. And one of the big ways that a person generally deals with alcohol poisoning, shall we say, is they throw up, right? They're trying to get the fluid out of the body. But the cannabis has actually calmed their system down to the point they can't actually vomit the alcohol, which opens the door to more damage and actually more risk that they can't get the alcohol out of the body. So again, this is one of those things that I've seen reported at a few locations, but I'd be curious to see more research about it. But I do bring that up as a possibility. Um, Another thing that I always like to talk about anytime you're talking about substances like alcohol and cannabis are impaired driving. Um, we know that cannabis can increase the risk of being killed in a collision by anywhere from 2 to 4 times. The US, it's reported that alcohol impaired driving increased the risk of a fatal collision by, I believe it's 22 times. But we've also seen research, I believe it was from the CCSA back in 2012, that said that according to roadside data and mixing cannabis and alcohol together actually increases the risk of fatalities caused through impaired driving by up to 40 times. So that's always a conversation that helps to have is just the importance of designating a sober driver. One thing I learned, actually, I believe it was from you and your associates at the CSSDP, was that importance of framing positive messaging as opposed to telling someone what not to do. So any conversation with a young person around impaired driving, instead of just telling them, don't drink and drive, don't smoke weed and drive. Well, if you don't give them another alternative, they're going to more likely wind up behind the wheel or with someone who's an impaired driver. So one of the things that I will ask a young person to do if they are planning on drinking, if they're planning on using drugs, is to designate a sober driver and have a backup plan. So that could be that they have a friend that's going to pick them up or a friend that's there that's going to drive them. It could be calling a parent. And for the parents, I always, mention the importance of being willing to help, even if substance use is involved. It's not about whether you approve of a substance being used. It's about the fact you want your child to be safe. So making sure they have that designated driver. And if they're planning on using a rideshare, make sure they understand how the rideshare app works. Take Uber, for instance. My understanding of Uber is that it's required you have to have a credit card attached to an account to hire an Uber. So if you're a teen, if you're a college student, first year, second year, you go downtown or you go out to a party and you say to yourself, well, I'm going to have a few drinks, take a couple puffs, and I'm just going to call an Uber. Well, if you've never used the account before and you don't have a credit card on you in the middle of the night, you can't really set up an account, which may already be difficult to do if you're impaired. So again, it's making sure those plans are put in place. And the reason I always say to have a backup is plans change. I mean, how many times have you gone out somewhere with a plan that just doesn't go the way you want it to? It happens. So making sure that they have that sober driver with a fallback plan is vital. Um, so yeah, so really talking about highlighting risk as a possibility, not telling them this is what will happen, but saying it's what can happen. Identifying the importance of designating a sober driver, and really highlighting that idea that if they're choosing to use a substance and they're trying to feel a certain way as a result of use, it's also important to point out that if they mix that drug with other substances, their expectations are going to change. Cannabis is, for some people, a hallucinogen, a stimulant. Alcohol is a depressant. Mixing those two substances together can have very different effects on a person's mental state. So if you're consuming cannabis expecting to feel one way, but alcohol is going to make you feel the other, again, this may open the door to you using more of one, or of the other, or both, to try to get the expected outcome.
No, I think it's really great to hear the way that you frame that as well, Steve, and really supporting a young person rather than telling them what to do and understanding why do you use and how can we support you in reducing the harm instead of just don't make substances, because a lot of research has shown that that's often the best way of approaching the conversation as well from a harm reduction lens. Um, I guess along the same lens of having those kind of supportive conversations, I wanted to shift the setting to more of a healthcare setting where individuals who may be interacting with the healthcare system who are using multiple different substances. You mentioned that obviously different substances can interact with pharmacological medications that you may be prescribed. Providers may not have as up-to-date information on different drug reactions. Patients may not have this information. And so just wondering, what advice do you have, one, for individuals navigating the healthcare system who do use multiple substances, and two, just even any resources for healthcare providers or those providing care to patients, to understand more about what some of these interactions are with some of the medications that we prescribe?
Absolutely. To really answer that, I'm going to start with the second question first, and then I'll come back to the first one. So the first resources that I always recommend are speaking with your healthcare advisor, whoever that is, especially if you are someone that's using any medications at all. I mean, it does help just to check in with your doctor, with your healthcare provider, that say you're using a prescribed stimulant, say you're using a prescribed sedative, that you understand and you're forthright with them that I do smoke weed, I do drink. How can this affect that substance? They may have a conversation with you. They may try to talk you out of using cannabis, using alcohol. They may also say, well, you know what? Maybe this line of a prescription is not right for you. Let's consider something else instead. You want to be able to have these open conversations. The more honest you're going to be, the more holistic of a response you're going to get. A second resource I actually learned about while I worked at the Y, that I was quite enamored with, was it's called drugcocktails.ca. It was actually funded through the BC Mental Health and Addiction Services in partnership with Provincial Health Services, BC Children's Hospitals, University of Ottawa. Um, and what it is, you can actually search a medication by its generic or brand name, and it will actually show you the intersections that it has with other drugs. So, for instance, if I were to look up, say, ibuprofen, which we know is Advil, or Motrin, ibuprofen. The link on the page, they actually have information about alcohol, tobacco, caffeine, cannabis, cocaine, opioids, amphetamines, phenylamide, cyclicide, etc. So let's start with cannabis. Cannabis may actually slow down the removal of ibuprofen from the body. This might give you more side effects from ibuprofen, like an upset stomach or heartburn, and increase the risk of bleeding. Again, Advil itself doesn't sound like a very risky substance to use, but mixing with cannabis might complicate its effects. Mixing ibuprofen with alcohol. Alcohol can irritate the stomach lining, so can ibuprofen. Mixing those together can increase the risk of nausea, stomach pain, or stomach bleeding. So it's kind of just it's a really quick one. And the name of the substance that you're using, the medication, the prescription, what have you, and it'll actually show you its intersectionalities with these different substances. Another one that's great, I recommend for parents especially, and for family members, is Drug Free Kids. We actually have a resource called the Parent Support Hub. So if you have concerns about a youth using substances, or you have questions about a substance that a youth is using, you can actually reach out to our Parent Support Hub 24/7. It's totally free. You can find it on our website. It's anonymous. You'll actually get connected with a mental health professional. And in situations whereby, say, there's a real, I'll say, a real concern there. There's harm being seen, or a perception of harm, or a possibility of harm caused by substance use, or issues with dependency, or concerns about things like co-use. Client can actually be referred to a mental health counselor through the Parent Support Hub for up to 5 free counseling sessions, which is lovely. And what's even more lovely about our Parent Support Hub is that there is no wait list. We know that many counseling services have wait lists anywhere from 6 months to 2 years to 2.5 years. So it does offer that very quick intervention, that very quick support, that if you do have questions and you're looking to learn more in a specific situation, our Parent Support Hub is a wonderful resource for that. And I'm always happy to connect you with the resource there. And to really answer the first half of the question of what would be the advice or the suggestion I would have for someone that is really looking for this sort of information, I think it's a case of making sure that you're honest with yourself as much as you're honest with other people about your substance use. And what I mean by that is, I mentioned earlier that plans change. If you plan to say that you're going out on a Saturday night, I'm not going to drink, so I don't have to worry about alcohol, but I might smoke a little bit of weed. But if you're someone that you know consumes alcohol, you're someone that will have a drink from time to time, it's okay to acknowledge, you know what, I might have a couple beers. And if I do, then maybe I have to actually stop and think, do I want to smoke weed at the same time? And if I do I want to have as much? And having that time to reflect and really be honest with yourself about those sorts of things, instead of feeling guilty if you're going to do it, or feeling guilty if you're going to consume more than you're planning on having. all of that guilt is going to do is stop you from really looking for support, is really stop you from wanting to talk about it. So there's that case of making sure that we're honest with ourselves and acknowledging if we're consuming substances to feel a certain way, or we do feel guilty, or we do feel that way, to think about why do we feel that way? And that leads you to the idea of making sure that you're honest with the people around you. If you are consuming a substance and you start to feel unwell, and someone tries to ask you, you know, um, they're going to ask you, you feeling okay, but they're also going to ask, like, what have you been taking? What have you been using? It's very important to point out those sorts of things if you can. I mean, so obviously, when someone's too impaired, they may not be able to communicate that. But in these situations, there may be a situation that someone may have to call emergency services. Someone may have to call 911. And it does help to know if this person was drinking. Well, what if they were also smoking weed at the same time? If this person was smoking weed, well, what if they were taking, snorting cocaine at the same time? If they were drinking, well, what if they were also taking benzos or they were using opioids too? Having that honesty and being able to speak up about substance use in itself, it reduces stigma, but more importantly, it really helps keep the conversation about safety. And for those of us that hear that, for those of us that hear someone acknowledge or admit to us that they're using substances, there's an importance there of needing to be accepting and still acknowledging that that person is still important to us. And the fact they've come to speak with us is because they trust us.
Yeah, no, I think that's so helpful to consider that from both perspectives. I love the resources that you provided. I know I'll be looking up some of those when I'm working with different patients in the future as well. So really appreciate that. The other piece that I just wanted to build off of that you ended on talking about is this important for honesty and needing acceptance from the other side. So one of the questions that we got that I would love your thoughts on, sometimes people can be a bit worried talking to their doctor or other healthcare providers about substance use because of fear of judgment. And so I'm just wondering if you have any tips on how individuals can navigate this conversation with their healthcare providers.
Absolutely. Absolutely. That fear, there's a very reasonable basis where that fear comes from. For a long time, many substances are either still illegal, or in the case of cannabis, they were only recently legalized. There's a fear of judgment there, a fear of how someone will be treated. And this is actually why I think it's important that we maintain these connections with the healthcare sector, that we continue conversations with policymakers. This is actually why I applaud the work that you do. This is why I'm such a big fan of what you do, because just like we have that presence in the community, just like we have that presence with partners to advocate for an importance of acceptance and understanding, I've seen that in the work that the cannabis and mental health program has done for the last few years, that you have a presence and you have the ear of policymakers and of the healthcare sector, and reminding them that they need to meet those clients where they're at. One of the things that I am a big fan of is presenting to programs that are training future social workers, training future nurses, training future mental health and addiction counselors, to remind them that their clients are using substances, but that fear of wanting to speak and that fear of reprisal is preventing them from actually coming forward. And the problem is that can't change overnight. I really wish it could, but there are healthcare providers that may still judge a client for something like that, that may still, you know, treat them differently, or look upon them differently. And that's where I think it matters to make sure that you can be honest with your healthcare provider and with your doctor, but also understanding that they may not respond the way that you want them to, I guess, for lack of a better term. And this is where I really hope for the professionalism of the healthcare provider, but I can't guarantee it. So I think it helps to be able to reach out to services, for instance, like the Hub, like Kids Help Phone, Good to Talk, are great to have those conversations as well, because then you're speaking with providers who part of their training is to really have that acceptance, to really make sure that they're not coming in with preconceived notions and judgments. And it does help prepare you for those conversations at the more clinical level. So again, it's not a simple process. If it if it were, there wouldn't be that stigma. Um, but but I think it starts with practice, practice on the side of the individual using, but also practice on the side of the healthcare sector.
I really appreciate you saying that, Steve, because I think that's something that, like, through my work, I've been trying to, like, really take a lot of the pressure off of the individual who, like, may or may not be using substances when interacting with the healthcare setting. Is it's like, yes, it is, how you can navigate, but also what the healthcare provider or practitioner can do to better support you. And I just want to plug something really quickly. These are some new resources that, Steve, I don't know if you've seen yet through Get Sensible. So we created them with the Canadian Public Health Association. So this is a zine for young people talking to healthcare providers. And it's a guide for young people in Canada who may or may not be using substances. And it goes over like youth patient rights, red flags and green flags in your healthcare provider, and then as well, like successful tips for preparing for an appointment. And a harm reduction tip that I always instill, like in festival settings or even going out, is the buddy system, which really helps with, like, as you're mentioning, like planning a safe way home and just having open conversations, like ensuring that you have a buddy with you, whether you're tripping or just going out one night. And then as well, here, a buddy system for doctor's appointments. If you don't feel quite comfortable like having those conversations one-on-one with your healthcare practitioner, you can have it, you can have a buddy there. And then there's also this checklist, which is for healthcare providers, so that they can find ways to better support the young people they're serving. So it starts off with first addressing and assessing your own bias. I'll also link this when we post it on the YouTube channel. But yeah, I love how you mentioned that, like, it also takes a little bit of time and compassion on the healthcare practitioner as well. I will
I
ask
think.
this other. Oh, go ahead, Steve. Yeah.
Oh, sorry. I was just
No,
going to
no,
say
no.
I like that you pointed out the importance of the buddy system and having a presence there. One other thing that I always mention to anyone when it comes to substance use, especially young people, is the importance of knowing their rights in an emergency. And one of the biggest ones I always point to is the Good Samaritan Overdose Act. If a youth is impaired or if they're with someone who's impaired, that they begin to feel significantly unwell and they're concerned for that person's safety. This is especially the case with things like opioids, but alcohol definitely plays a factor into this. Alcohol in anything can increase the risk of some very, very dangerous health effects in the short term. So if you ever do feel that you're in a situation that you need to call emergency services, Canadians are protected under the Good Samaritan Overdose Act from misdemeanor charges for things like minor possession or just for simply being intoxicated. They will not be charged for those sorts of things. So they are legally protected there. Now, there are limitations to the Good Samaritan Overdose Act, and I usually highlight those as well. For instance, if emergency services show up, someone has blacked out, they've had too much to drink, they've been smoking weed, they've been seeing things, they've been hearing things that aren't right, and they're passing out, they're coming in out of consciousness. EMS shows up, they see this going on, they're going to ask if they've used something. Thank you, thank you for letting us know. We'll take it from here. They'll take care of them. No charges filed. But if EMS shows up and either they find another crime being committed, for instance, if they suspect that the house is trafficking drugs, or they see a bunch of, I don't know, unregistered firearms all over the place, or a fight going on outside. I use some hyperbole for examples, but the point is, if they see a different crime being committed, they do have to report those sorts of things. And the act does not protect against outstanding warrants or outstanding breaches of probation. So there are those things to be considered as well. So they do have rights, but they do only go so far. So I make sure youth want to understand that to the fullest.
I love that. And honestly, I did not know that that was a part of the Good Samaritan Act. I wasn't aware of my rights. So thank you for educating me. That's really, really great to know. Yeah.
Again,
Yeah.
a lot of people think it's opioids, it's drug use in general.
Yeah. Yeah.
So
Totally. Thank you for that. There's another question here. I think it'll be one of our last questions. So I'm not sure how to help a friend who frequently combines alcohol and cannabis. How do I support loved ones who choose to use multiple substances at once while respecting their decisions that they make for their own body?
at DFK, we talk a lot about the importance of conversation starters, but we also talk about the strategies of having the conversation. And the first thing to understand is that you want to try to set realistic goals. Again, if your goal is, I'm going to make sure they never do it, good luck. It's probably not going to go that way because you still have to respect their agency of choice. A more realistic goal is making sure that you started and opened up that communication. You can express concern, but using a word like you're concerned about their substance use is different than saying you don't approve of it. So if you know that someone is drinking and smoking weed, and you want to try to frame the conversation around the fact, like, I don't approve of that. I want more from you. That's not actually helping them. That's actually just showing that you look down on them. It comes across as condescending. But if you can point out the fact, I want to have this conversation with you because I'm concerned. Not disappointed, I'm worried. Using words like that help to frame the conversation in a little bit more of a light that you're basing it around trust and you're basing it around safety. I'm highlighting these things to you because I'm concerned for your health. They may shrug that off. They may. But one thing that we've learned, actually, even in our own tracking studies at DFK over the last few years, is that 2/3 of teens actually say they get their most reliable information about substance use from their parents. So I always say this for parents, that when you're having these conversations, it's the strategies that you use and how do I build off of their ideas? How do I point out that I am concerned, that I'm worried? Like I said, it's avoiding those words like disapproval and disappointment because those are conversation enders. That's going to think about when you were a kid. If someone said they were disappointed in you, you probably didn't really want to speak with them. You probably felt guilty. If they said they disapproved of you, you probably felt like they were judging you, and they were. Even when it comes to looking at things like polysubstance use, other language to avoid is things like saying that it's bad or that it's dumb to use or that it's stupid to do, because again, those create judgment. Substances themselves are not moral. They're not good. They're not bad. They are substances. That would be like saying a hammer is a bad thing. You can build a lot of great things with a hammer. You can mess someone up real bad with a hammer. That doesn't make the hammer good or bad. Cannabis does have medical applications. There are many people that can use cannabis recreationally, that they set limits, they designate a driver, they use in a safe space, they know where they're getting their supply from, that they can have a great time without running into problems. There are others that may not want to use cannabis because they deal with issues like panic attacks, anxiety. Maybe they have a history of psychosis or schizophrenia that using THC may complicate or worsen those symptoms. That doesn't make the substance moral or immoral. It makes it potentially risky, potentially harmful, potentially unhealthy. And framing the conversation in that regard does help to initiate more of a meaningful discussion than simply trying to tell them, drinking and smoking together is bad for you. Because if you identify it as bad and they do it, in their mind, you're identifying them as bad. If you can point out the fact that it's unhealthy or there's risks to your health, here are some examples of them, the things we talked about before, it gives them something to think about. They're not telling me how to live my life. They're just saying, here's some of the things I can expect. Ultimately, the decision is still that person's to make, but the more information they have, the more likely they are to make a safer choice.
I think that's so key as well, Steve, and you brought it up multiple times during the conversation, just this idea of allowing someone to make an informed choice and withholding that kind of judgment, or even in the terminology you use, really small words that you can use can really affect how a person feels like they're being viewed by you. And you've talked about throughout, this time of how important it is to have other people aware of the substances that you're using as a form of reducing the harm and also as a form of being able to get support that you need. And so I think that's so key in recognizing the way that we approach this and have those kind of conversations, which are so often involved with so much stigma. And so I think that the specific words you used, even it's really helpful for me to reflect on how, when I have these conversations, do I unconsciously bring up these words and how does that cause a person to feel and kind of maybe detract from the conversation? Yeah.
I'm glad that you framed it like that, because actually one of the things that you just did in your response to me is another strategy that I really love bringing up. It's the importance of active listening. When when a youth brings up a point, when someone that's using substances explain their situation, being able to reiterate what it is that they've said to you shows that you're listening. Um, my wife gives me a hard time from time to time. She says you're good at listening, but you don't always pay attention. So one of the things that I work at doing, that I practice doing, is when I hear something, I try to repeat it back. So the idea of hearing the message that they're sending to you, you highlight the key points that you hear in that statement from them, and be willing to admit that you're wrong, and be willing to admit that you don't fully understand something. Even in doing that, it invites them to keep speaking. And I wanted to highlight that because, like I said, you exactly just actually carried out one of the things that we talk about, that importance of active
Right.
listening, which is crucial in any discussion about substance use because it keeps the conversation going.
Yeah, absolutely. And I think it's, going back to a lot of what we learn when we're interacting with patients as well, is the most that you can give someone is your presence. And I think really being actively there, listening, not trying to think about how you'll respond or judging what they're saying, I think is so key to building that connection. So really appreciate you bringing up that point as well. I know we're just about nearing the end of the hour, and I did want to give you a chance, Steve, to share anything that we haven't asked that you think is important around this topic of polysubstance use based on all the experience that you have, anything for individuals who use, family members, healthcare providers, anything that you think would be helpful to leave and end off this conversation with.
I think, and I've seen this a lot since I moved over to working with DFK. And at first I thought it was because I cover so many different substances now, but I'm just seeing it in communities in general. Is discussions about alcohol have really been forgotten by a lot of communities. When I was conducting outreach and I was connecting with communities in Northern Ontario, Central Ontario, Eastern Ontario, and saying that we're developing presentations, we're creating workshops on conversations on substance use. Are there particular substances you want us to focus on? I was expecting the response was going to be opioids. I was expecting the response was going to be cannabis. Cannabis is still there and opioids are still there. But when a lot of them realized we could have a conversation about alcohol, it caught them off guard. They were saying, we haven't had meaningful discussion about alcohol in 20 years, in 30 years. But yet, alcohol is the most commonly used psychoactive substance other than caffeine in North America. But we know it can be an extremely dangerous substance, particularly for young people, particularly for people that use and mix it with other drugs. So I think any conversation about polysubstance use, one of the most important things to cover is the risks of alcohol associated with those other drugs. Mixing alcohol with opioids, we know increases the risk of fatal overdose. Mixing alcohol with stimulants increases the risk of hospitalization. Mixing alcohol with cannabis, we know increases the risk of hospitalization. Alcohol is one of the only drugs that we know that actually damages every organ in the human body. And again, when you marry that to cannabis, which may not have quite the list of harms, although we are seeing more recent research suggest that cannabis has links to certain health conditions that we previously didn't think much about. For instance, heart attack and stroke. We actually saw, I believe it was the Canadian Medical Journal in 2021, 2022, posted research, multiple studies showing links between myocardial infarction and cannabis use in young adults and middle-aged adults. So again, it's really just keeping up on the research. And I think that's sort of where this discussion came up about alcohol was people hadn't heard a lot about it in 20 years. They knew it was a harm, they knew there was a risk, but they hadn't heard more recent things. So I think it's important when you're discussing polysubstance use that alcohol comes up as part of it and how it interacts with those other drugs. And that's again why I do applaud the fact that this is a topic that you wanted to approach tonight, because cannabis is the most commonly mixed substance with alcohol. So we're better to start on both than with each other.
I think that's such a key point. And I mean, we just want to end off firstly by thanking you for taking out the time and sharing so much from your knowledge and expertise. I think there's certainly a couple of key takeaways for me around learning a bit more about the science of what happens when you mix substances. How does it really differently cause cannabis or alcohol or tobacco to impact you in ways that you wouldn't think about when you're consuming? And those different pieces are in harm reduction that are different for individuals who use more than one substance. And I think the other thing that really stuck out to me was just this idea that was brought up again around friends and healthcare providers and others are really approaching this topic with a lens of non-judgment, of acceptance, and really trying to understand where a person's coming from, why they're using, what it's doing for them, and allowing that to stimulate more conversations that ultimately reduces harm for everyone that is involved. And so I really appreciate that approach that you took to it. And I think we've certainly left with a lot to learn and a lot to take away. And just wanted to build off the last point that you mentioned, Steve, around education and needing to present things in more of a digestible manner. I think this has been really helpful for everyone that will be watching, and just wanted to also mention if people are interested in learning a bit more about cannabis and things like reflecting on why you use or how you can support others, you'll find a lot of resources on our website, cannabisandmentalhealth.ca, for youth or other individuals looking to just learn more, or even for educators, peer support workers, and parents and youth allies to learn more about what it looks like to support family members or to support others who may be using substances. And so that's a great resource that you can certainly check out, our YouTube channel as well. And Steve's brought up a really great ones throughout this conversation to refer to during practice and to refer to as an individual. So I hope you're certainly left with a lot of resources to take a look at, and we'll post links of all of these below the video as well. Thank you again, Steve, for your time, and thanks, Kia, for being here as well. It's been such a pleasure to learn and to absorb some of the vast knowledge that you have in this area.
Thank you. I do appreciate you having me in this evening. And again, we have great resources at Drug Free Kids. You can check out our website, drugfreekidscanada.org. I'll make sure the link's sent over. But I do want to thank you particularly, Kia, as well, Hargan, that you've hosted this discussion. I've said this before. You mentioned at the beginning of the presentation or the discussion, Kia, that we've worked together a lot over the years. I'm very much a fan of the way that you approach this content in this program. Your approaches, the way that you connect with youth, the way you connect with communities, and the modules that you created on cannabis and mental health are incredible. I still promote them everywhere I go, and I would gladly do that. They're wonderful. You have incredible work, and it's great to see another example of that tonight.
Thanks so much, Steve. We're big fans of you also, truly. And thank you so much for taking taking the time.
Oh,
And
pshaw.
really, really hope you enjoy your 5-day weekend. And take some
Look forward
time.
to it.
Take some time for yourself. Awesome.
Thank
Thank
you.
you
I'll
so
see
much,
some.
everyone. As we mentioned, this is also a part of a series, so do keep your eyes out for other discussions on polysubstance use. We have other ones coming up on cannabis and prescription medicines. And yeah, we'll see where this conversation goes. Awesome. Thank you.